everyone, today I will going to perform the parenteral drugs administration using the intradermal and subcutaneous. Last is intramuscular injection. The procedure that I will going first is intradermal injection. The introductions of a solution by means syringe and needle and the superficial layer of the skin that I'm doing. So, important to observe the right of drug medication administration to ensure that we're giving the safest care prior the conduct of the procedure. First things to do is to check the doctor's order on the patient medication record. So, first is I will going to check the medication that we're giving to the patient. So here is the record of the patient. Okay, so this chart is to identify what kind of drug is to given to the patient, or to assign, to identify the drug's name or its dosage, routes of administration, and giving time. So perform hand hygiene to deter spread of microorganism and ensure safetyness. To prepare the medication, of course, we need to have syringe. So I have here tuberculin syringe here, which ideal for skin test of intradermal injection. Of course, I have here 23 gauze syringe for intramuscular aspirating needle. So I have here aspirating needle here. Open the tuberculin injection to sterile package. We can touch barrel, of course, and plugger of the syringe. So, put the aspirating needle to the tuberculin syringe. And now, tell the syringe and cap the syringe, okay? The volume of air that needed to be drawn inside the syringe is equal to amount of medications. After that, inject the air into the vial, invert the vial, and draw the exact amount of medication that needed. Now, if there is an air bubble, drop inside the syringe, tap the barrel, remove the aspirating needle. So, get the cotton ball and pour the vial in 30 seconds. So discard the vial. And now inject to the vial. And know that and discard the aspirating needle and back to the normal of the tuberculin syringe. So next is put the name of the medication that we're going to give in to the patient. So, next is I will going to proceed. So, review the medication that we're giving the physician. Okay? Next is arrange your all equipments. So I have here all my equipments. So after that, introduce yourself and verify the client identity and also explain the procedure to the client. So good morning, ma'am. My name is Jen L. Erlinida. Today I am your student nurse. So what is your name, ma'am? Okay. How old are you, ma'am? Okay. Can I see your wristband, ma'am? Or can I touch your hands? Okay, thank you, ma'am. So today, your Dr. Morgan has ordered for a penicillin skin test, which means I have to inject just a small of penicillin into your skin to check if you are allergic or not to penicillin medication. So today, I will going to perform hand hygiene to deter spread of microorganisms to proceed to our procedure or handling before and after handling the patient. So now, choose an injection site free or lesions or discoloration. Select the side 3 to 4 finger with elbow to anti-cubical space. I-touch ko, ma'am, imo. So, and one hand above the wrist pose of clients, arms that his elbow and forearm is supported into a flat surface, and then apply clean gloves. Now use an antiseptic swab to clean the site, beginning at the center, circling outward about 5 cm. So I'm gonna so discards. Now remove the cup and the syringe between the thumb and the forefinger with the bowl of the needle pointing. Up, stretch the skin taut, gently folding the thumb and the forefinger non-dominant hand. And do not massage the area. So, fold the needle very close to the patient's skin. Insert slowly at a 5 cm to 15 degree angle. Anti-resistant is filled. Advance the needle up to the epidermis 3 mm and slowly inject until you see a resembling at a mosquito bite occur on the patient skin. If a will appear, it means that our solution are in the intradermal tissue. Now withdraw the needle the same angle, pat dry cotton ball. Now get the cotton ball dry. So next, encircle the blood with a blue or black ball pen and instruct the patient not to rub the wheel or erase the mark, a red. So, they may influence their calling and massaging the area may influence or interfering with the test result by spreading medication. The subcutaneous tissue were done your skin, sir. So, ma'am, but we have still wait to 2 minutes if they have an allergy of your skin. So, we're done our procedure. So now remove your gloves. And after that, wash your hands for not spreading the microorganism. So next, documents all the findings about the procedures. Okay, done. Do not use the syringe if you have the next procedure or next giving the medication. To not inspect or not So next is I will going to proceed the parenteral drugs medication. The second is subcutaneous injection is the introduction of a small amount of solution by means of syringe and needle into the disposed tissue between skin or breast skin. Then next is I will going to perform hand hygiene to deter spread of microorganism and ensure safetyness, and before and after handling the patient we need to perform hand hygiene. So after that is I will going to prepare all my equipment. So I have here my all of equipments. So after that is insulin syringe. We need to read, or before that is I will going to review the medication that given of the physician. Okay, we're the same. So after that, insulin syringe, we need to open sterile cap, take it out, the syringe, and discard, and uncut the syringe. And the cell syringes are cup syringes. Okay, volume that is needed to be drawn inside the syringe is equal to half amount of medications. So after that, inject air into the vial and birth the vial and drew the exact amount of the medication needed. So after that, inject. So needed amount of the patient's medications. So now, trap inside the surgical so no bubble here. I'll back the. So next is I will going to record the medication of the ticket that we're going to use for our procedure. So next is documents of the same medication that we're giving the procedure. So next is I will going to introduce myself and verify the client identity, and also we need to explain the patient the procedure that we're going today. So good morning, ma'am. My name is Jen Elorinida. For today, I am your student nurse. So may I know your name, ma'am? Okay. May I know your age, ma'am? Okay. Can I see your wristband, ma'am? Can I touch your hands, ma'am? First. Okay. Thank you. So after I will going to explain the procedure today. I'll be doing skin test, subcutaneous insulin, have injection insulin in this part of your abdomen, control your blood sugar. And you have type 1 diabetes, that will be alright. So okay. So before that, I will going to perform hand hygiene to deter spread of microorganism and also prepare all of my equipment. So I have here my all equipments, and I will going to perform hand hygiene for the next procedure. So now determine the site will be used and expose the potential injection site. So I will going to expose the abdomen part of the patient. So now inspect the area for any brushing inflammation or edema. This side could be the outer speck of the upper arm, the abdomen just below the costal margin into the iliac arrest, and the anterior aspect of the upper thigh. Palpate the site and avoid any area. So sir, I will going to inspect your abdomen. Okay. So okay, then after that I will going to palpate your abdomen. Okay. So now I use an aseptic swab to clean the site, beginning at the center circle outward about the 5 centimeter. Circular motions or toward. So next, use now remove the cap of the syringe. So next is pull the needle cap and hold the syringe between the abdominal thumb or holding a dart. Insert the needle quickly and firmly at the 45 to 90 degree angle. Pain is minimized by inserting the needle without the hesitations. Release the pain skin and raise the abdomen and hand on the patient. So take it off the syringe. So next is we're going to get the cotton balls. And not to massage the area that we're going to inject for not also irritation or infections. So that will be all of the subcutaneous insulin injection. So we're going to document all of the findings and perform hand hygiene to deter spread of microorganism. Before that, don't forget to explain to the patient that we're done going this procedure. So some more rest of the patient. So after that, I will go to perform hand hygiene to deter spread of microorganism. So I will go into the next procedure. So the next parenteral drugs medication is intramuscular injection. As the inductions of introduction deep into the muscular muscles tissue, where a large network of blood vessels can absorb it readily and quickly. The preparation of intramuscular injections, and the doctor has ordered 5 milligrams of morphine sulfate medication to address pain of the pain. So how to get the 5 milligram? So we're going to multiply the 5 milligram more pain sulfate be divided with stock on hands 5 milligram per 1 desired dosage divided by the stock hand multiplied by the quality 5 milligram multiply 1 millimeter, that the answer is 1 millimeter or 1 milligram. So next is I will going to perform hand hygiene to deter spread of microorganisms and safetyness, ensure the before and after handling the patient. So next is I will going to prepare all of my equipment. So I have here my all of equipment. So next is I will going to get my syringe. So I will going to use my aspirating needle before I use my needle and syringe. So take it off the syringe and I take off the needle. So put the aspirating needle. So you will doing same in the first and the second thing. Now tail the syringe and cap the syringe. Okay, volume of air that is needed to be drawn inside the syringe is equal to amount of medication. So okay, after that, inject the air into the vial and burst the vial and draw the exact amount of medication that needed. The needed of the medication is also 1 millimeter or milligram. So now if there is an air bubble trap inside the syringe top barrel, remove the aspirating needle. So I will going to remove the aspirating needle cup. Then before that, I'll get also the cotton ball 70 soak solutions. Then before that is you will going to clean the vial and 30 seconds of the 70 solution alcohol. So next is I will going to discard or dispose the using cotton balls. So next is take it off the cap of the needle and then go to vial. Then get the amount of the medication that needed. 1 millimeter. And now we're going to take it off the aspirating needle and get to expose. And next is back to the aspirating needle and discards. So we're going to put to the hypogastric 3. So before that is assuming that I have a hypogastric 3. Before that is I will going to document all, or I will going to take notes the medication that needed to the ticket. So the medication that needed is also warfarin. Okay, then next is I will going to proceed to the next part of our procedure. So I will going to introduce myself and verify client identity and explain the procedure to the patient. So good morning, ma'am. My name is Jen Elerlenita. I am your student nurse for today. So can I ask your name, ma'am? Age? Can I see your wristband, ma'am? Or can I touch your hands? Okay, thank you. So after that, I will going to explain you about what we're going today. So Dr. Morgan has prescribe you with morphine sulfate to elevate your feelings of pain. Okay, select appropriate site for injection, batus literalis and deltoid muscle of possible site for intramuscular injections. So also examine the integrity and amount of patient mode mass and palpate the muscle area if their tenderness when site might not be sustainable. So inspect the area for bruising, inflammation, and edema, and the skin shows bruises, inflammation. So sir, I will going to inspect your back. Okay, in the comfortable. Okay. So for ventral collateral injection, place the heel of the hands over the greater truncator of the patient's hips with the rest almost perpendicular on So the femur point to the thumb toward the patient groin. Point the index finger to the interior superior iliac desire and extend the middle of the finger back along the iliac cheese. For this, inspect the injection site of ocular position pattern and inner to the outer for about 2 inches. Hold the gauze for between third of the fourth. So outer, inner. So just below of the injection site and hold the patient's skin laterally about 1 to 1.5 inches. Hold the position until insert the needle. So I'm gonna take it off the cap of the needle. Then next is insert to the hips, outer or inner. And blood vessel, its blood appear, then it means that you have hit a blood vessel and 1 centimeter to 10 seconds. Then same thing, take out the needle, and before that discard the needle that discard the syringe and needle that used to the procedures. So explain to the patient that the procedure are all done. So back the position of the patient that they're comfortable. So sir, ma'am, back to the position that after 10 seconds. After that, all of my procedure from intradermal injection, subcutaneous injection, intramuscular injection, all of them we're going to document all the findings. And don't forget to wash your hands with the spread of microorganisms. That's be all. Thank you.